were sleeping, our team was keeping tabs on what's happening with the coronavirus, and here are the major points that we want you to know this morning. According to a model from the University of Washington, the peak day for deaths is now behind us. But the model says today will be the peak for hospitalizations across the country. They warn as people celebrate Easter this weekend to do so responsibly. Closer to home, Mecklenburg County is warning that some rapid tests for COVID-19 could be giving false results. The public health director says there's at least one non-FDA approved test being used. We'll have more on that in just a second. But right now, we want to tell you about some news that's tough to report. 2 babies in Mecklenburg County tested positive for the virus, and we know both of them are less than a year old. Well, this morning, we don't know how they're doing, but we do know that children tend to get much milder cases of coronavirus than adults. We looked over information from Johns Hopkins University, and that data shows symptoms in children are usually extremely mild compared to what adults get. And while they'll still have high fever and some difficulty breathing, it's extremely rare for a child to have to go to the hospital. Well, county health officials are warning that a rapid test for COVID-19 could give false results. The product they're worried about is the same test being given to patients at Star Med Family and Urgent Care. That's on TUCKASEEGEE Road in West Charlotte. The FDA has not approved these tests. County Medical Director Dr. Meg Sullivan says that there are a couple of issues with it. The test may not be very sensitive, meaning it might not pick up COVID-19 early on, resulting in a false negative. If someone tests positive, that might not be true because the test isn't specific to this strain of coronavirus. Our Joe Bruno called the clinic's medical director.
This test you're offering now, it's not FDA approved. It's not even accepted by the Department of Health and Human Services. Why should people trust it?
Because it does work.
But how do you know?
Because they've done the studies on it in other countries.
Now, Joe also asked why he doesn't use an FDA-approved test. He says there aren't enough of the swab tests out there, but more are coming this week, and the plan has always been to switch to them. Now, the county's fear with these potential false negative tests is that it'll give people a false sense of security. But the medical center sent us documents after that phone call, including the paperwork that patients leave with. And it specifically says this test can be negative, especially early on, even if you're infected. Then in all caps, it says testing negative does not mean you're allowed to go out and ignore current curfews or stay-at-home orders. All right, let's take a look at the numbers right here in Mecklenburg County. They actually give us a sign of hope. While the county has 913 cases, half of those patients have already recovered and are out of isolation. About 1 of every 5 patients had to be hospitalized. However, 12 people have died. Now a quick look at the state numbers. 3,900 cases in North Carolina. 74 people have died. And we do not have state numbers on how many people have recovered. In South Carolina, there are over 3,000 cases, including 125 in York County. In all, 72 people in the state have died. Now, on the business side, economists say that we are officially in a recession. The experts do think, though, that we will bounce back in the second half of this year. But they say the economy might need help from a federal stimulus package. And no businesses are immune from that recession. We just learned more hospital workers are losing their jobs. This time, the Holston Medical Group is letting go some of its workers. An email sent to employees yesterday said that their position has been eliminated. The group is closing many of its offices in the Lake Norman area, but it didn't say how many or which ones. The email lists 2 reasons for the closures: the outbreak and the loss of many doctors in their medical centers. We spoke to someone who wanted to stay anonymous, but who says the closure has been emotional.
My concern is for the people who work there, but also for the patients in the community. Some of these doctors have thousands and thousands of patients.
HMG said it will work with other providers to transition care. Well, get ready. Your shopping experience is about to change again. North Carolina Governor Roy Cooper filed an executive order making changes to grocery stores. To protect essential workers, they'll now have a plexiglass face shield. They'll also better enforce social distancing by only allowing 5 people inside a store for every 1,000 square feet of space. Now, we want to show you these photos from Food Lion. They have signs warning people about social distancing, new plexiglass shields between the customer and the cashier, and one-way arrows for the aisles. Now, stores are only a part of this executive order. It also extends to nursing homes, now required to screen both residents and workers, and employees are required to wear face masks. The governor eliminated some hurdles for employers, allowing unemployment claims to be processed faster. All of this starts Monday at 5 p.m. A second person at the Veterans Home in Salisbury has died from COVID-19. That man, who was not identified, passed away yesterday. His death comes 6 days after another resident of that facility died from the virus. A spokeswoman for the home said all of the residents of the Veterans Home are now being tested for COVID-19. KENDRA Johnson's father is one of them.
My father's amazing. We love him. We are praying that he's fine, that he gets through this, that everyone there gets through this.
The Veterans Home remains on code red alert with no new residents and no visitors allowed. Paramedics in Onslow County have come up with a simple yet effective way to protect themselves from patients who could be sick with COVID-19. Each ambulance has been stocked with one of these. Take a look. It's called an isolation tent, and as you expect, it helps stop the spread of germs or viruses between someone who calls 911 and the first responder who shows up to help.
We've made sure that all of our ambulances contain an isolation tent, so any one of our crews, day or night, no matter where they are in the county, if they encounter a patient that they suspect may be infected, they can put the isolation tent on. They can still take care of the patient, provide that 5-star service that Onslow County is known for, and protect themselves and the healthcare providers.
You can see each tent clips right onto a gurney, and they take less than 5 minutes to put together and will only be used on people who are showing symptoms of COVID-19. Two crew members on board the Navy medical ship Mercy have just tested positive for COVID-19. That ship is currently docked at the Port of Los Angeles. It's being used to treat patients who don't have coronavirus so that hospital beds can be freed up for patients who do have it. The Navy said the crew members who are sick are being isolated off of the ship, adding that steps are being taken to keep others on board healthy. Well, it's estimated that the pandemic could cost restaurants $225 billion in just 3 months. The National Restaurant Association says Congress needs to cut red tape around the Paycheck Protection Program. It helps businesses keep employees on the payroll and stay open. It sent a letter to Congress urging them to extend the program's deadline and even add more money. One Huntersville mom is trying to help local restaurants stay afloat, while at the same time showing our healthcare workers that they're appreciated. Jen Gatto purchased 40 meals from Lancaster's Barbecue yesterday. She started a GoFundMe page to raise all of the money to buy those meals. Channel 9 was there when the meals were delivered to staff at Atrium Health Cabarrus.
The medical field, definitely they're going to be needing these meals, but the restaurants especially are really going to need the continued support from the community.
All right, now this is pretty cool too. Gatto has also started a movement where healthcare workers send her videos of them singing. Take a listen. Nurses and staff have been sending Gatto videos just like this one with the message, "If you need us, we'll be there." Yeah, we've seen that time and time again. Gatto says she'll continue to help healthcare workers and first responders as long as the donations keep coming. Her next delivery is set for Tuesday. Well, last night was another noisy Friday night in Uptown as dozens of people raised their voices to sing and cheer on our healthcare workers fighting COVID-19 head on. The Charlotte Knights joined Atrium Health and Wild Wing Cafe for the Make a Noise to Make a Difference campaign. The Knights played Sweet Caroline and Take Me Out to the Ball Game over its loudspeakers at BB&T Ballpark. We spoke to the CEO of Wild Wings Cafe, and he says stepping out to sing along and applaud workers is the least we can do.
The hard part is you can't go see them, you can't go shake their hand, you can't give them a hug, and the only way we can support them is at least come out here and sing a song.
Yeah, something pretty easy for us to do. The songs were also broadcast on the radio, so those who live outside of Uptown could sing along. Organizers say they're doing this every Friday night at 7 o'clock.